of the cornea to grow back. As they do, vision improves. But it could take up to 90 days before full correction was realized. 3 months downtime is a serious setback for a Navy pilot. Captain Schallhorn turned his attention to a new variation of laser refractive surgery that had the advantage of much quicker recovery. The procedure, being called LASIK, had a big bonus. Patients were having optimal vision within hours or days, not weeks and months. Instead of reshaping the surface of the cornea, as with PRK, LASIK reshapes the inner tissue of the cornea. An ultra-fine blade cuts a thin flap across the top of the cornea. This is set aside while the laser sculpts the inner surface. Once the proper correction is achieved, the flap is laid back in place. After a few minutes, as the flap dries, it rebonds with the surface of the cornea. No stitches are required. Although LASIK had the advantage of faster visual recovery, the quality of vision, especially night vision, wasn't as sharp as Dr. Schallhorn demanded for pilots. It was at about this time that a new technology came on the scene, wavefront aberrometry. NASA had used it to analyze and correct optical problems with their orbiting Hubble telescope. With wavefront, a beam of light is shined into an optic system. The light wave that's reflected back is then analyzed to detect any abnormalities, even the most minute. Dr. Schallhorn began using wavefront to analyze defects in the human optical system. This analysis was then used to guide the laser to correct for each of those defects.
We combined the technology, a wavefront guided or custom procedure to sculpt the cornea and correct the refractive error in a procedure that was really a new form of LASIK. And it was that new form of LASIK that we found overcame the problems that we'd seen previously with LASIK regarding the quality of vision.
But Captain Schallhorn still wasn't ready to recommend LASIK. He had one last concern.
How stable the LASIK flap is a critical consideration. If an aviator has to eject, we don't want that flap, that LASIK flap, moving.
Since the LASIK flap is cut by a mechanical blade, Captain Schallhorn was concerned that it could be dislodged by impact. But there was new laser technology on the horizon that appeared to have the potential to create the LASIK flap without a blade. It was called a femtosecond laser, thousands of times more intense than conventional lasers and capable of unsurpassed precision. Each pulse of energy is extremely short, a femtosecond, 1/1,000,000th of a billionth of a second. Firing thousands of pulses along a plane creates a layer of minute bubbles just below the surface of the cornea. The top layer separates as if along a perforated line, creating a perfectly uniform flap without a blade. The laser-cut flap has a perfectly vertical edge, which when returned to the cornea locks into place like a piece into a jigsaw puzzle. Captain Schallhorn was finally satisfied, and this new technology LASIK was approved for naval aviators.
After combining these two technologies, the femtosecond laser to make the LASIK flap with a wavefront guided or custom treatment to correct for the refractive error, the sum was greater than the parts.
With this new combined technology approach, Dr. Schallhorn and his team of Navy surgeons were able to take laser vision correction to a whole new level.
The results that we've been seeing with our aviation study have been phenomenal.
One of the surgeons on that team was Captain David Tanzer. Using this new form of LASIK in Navy pilots, Captain Tanzer was routinely producing vision well beyond what's considered normal.
100% of our aviators we've treated are 20/20 or better uncorrected. 98% are 20/16 or better uncorrected. 92% are 20/12 or better uncorrected. And about 35% are 20/10. They max out our eye chart. So we're actually giving them vision as good as they can get.
Good. Watch it carefully. Good. Certainly there will be people in the civilian population that achieve these results. Others should not have the expectation of vision of 20/20 or better than 20/20. Epithelium probably is about 50 microns.
Dr. Doug Koch is a professor of ophthalmology at Baylor College of Medicine, specializing in refractive surgery. He says fewer patients in the civilian population have the same potential for visual outcomes as Navy pilots.
Well, the military's visual results are obviously outstanding, and I think the population is sort of unique. These are people who have very, very outstanding potential for vision. We can help patients understand what their potential for vision will be by a very careful screening process.
The Navy's aviator clinical trials helped advance the state-of-the-art in refractive surgery and made a compelling case that advanced LASIK could withstand the most extreme rigors of warfare and flight.
We looked at patients before and after this new technology LASIK, femtosecond and wavefront guided. And we found for the first time this new technology LASIK actually resulted in an improvement in night vision on average for patients. The first time we'd ever seen that in a refractive procedure. And that analysis led me to say, finally, I think we're ready to do LASIK in aviators.
That opened the door for LASIK in space. And in 2007, NASA also approved the procedure.
I wore contact lenses during my 3 spacewalks.
Former astronaut Pierre Thuot is a veteran of 3 shuttle flights and has logged 18 hours on spacewalks, all wearing contact lenses.
There is that concern that if one of them got dislodged or just moved on your eye, because you can't put your fingers up there and move them back, you'd be in difficulty. I certainly would have preferred to have had perfect vision like I do now, thanks to LASIK.
NASA had a strict prohibition against refractive surgery, and Captain Thuot couldn't get LASIK until he left the astronaut program and returned to the Navy.
NASA wouldn't have approved LASIK for the astronauts if they didn't think it was, absolutely certain that it would work for the astronauts and would provide them better acuity and allow them to do their jobs better.
And that represents a real milestone. NASA looked at the safety and effectiveness of LASIK in great detail over the years, and they have deemed it safe and effective for use in their astronauts. We should take great comfort in that, in knowing that it has reached that level.
Due in great part to the pioneering research conducted by the Navy, the combined form of LASIK has become the gold standard for laser vision correction.
What I call the best of the best is creating the LASIK flap, the protective LASIK flap with a femtosecond laser, correcting the refractive error with a wavefront guided treatment, which, again, under computer control, sculpts the cornea. That's how far we've gone with this technology. That's the best of the best.
Often referred to as all-laser LASIK, this combined procedure is producing a revolution in both the military and civilian communities.
It used to be that aviation required excellent vision with no glasses, 20/20 or better in each eye. And with this program now, it's opened the vista up for folks to have laser vision correction and enter as Navy pilots and aspire to a new dream.
The 2 things that mean the most to me about the refractive surgery program is that it has enabled more young men to walk through that front door and have their shot at becoming a SEAL. Secondly, from the community standpoint, it has enabled the SEAL community to make sure that we don't lose someone who might have been a great SEAL just because he needed glasses.
I'm that guy. And there's 500,000 other like me that have an opportunity to do something they wouldn't have been able to do were it not for this program and this procedure, and for guys like Dr. Butler.
With the military research efforts, they have very much complemented what we knew and learned from the civilian population. They were able to do larger studies, more focused studies on certain types of issues, so that we really expanded our knowledge and understanding of how to make it better, how to provide better quality vision, make it safer, and really broaden the population who can truly benefit from the operation.